Hello students, welcome to EPG Pathshala. I am Dr. Renu Tyagi from Department of Anthropology, University of Delhi. Today we will be discussing the module Aging and Nutrition from the paper Biosocial Gerontology. The learning objectives of this module are: number 1, to learn the importance of different nutrients in old age. Number 2 is to know the guidelines of the healthy diet in old age. And number 3 is to learn how to manage the nutrition related ailments among aged people. Now let's have an introduction about the nutrition and old age. Nutrition has a close connection with all the stages of life. It influences one's life from intrauterine environment till death. To understand the basic concept of nutrition is of immense need. One of the important predictors of the morbidity and mortality in the elderly population is the malnutrition. Good and balanced nutrition has a significant part in shaping the well-being of the elderly people and in postponing and decreasing the risk of contracting disease. Almost many of the diseases suffered by elderly people are result of the dietary issues, some of which have been in process since infancy. Nutrition is the science of the relationship of the health, well-being and disease to ingestion, absorption and use of the food and nutrients. Understanding of the physiological processes such as ingestion, digestion, absorption, cell metabolism and excretion is required for the exact nutritional assessment. Nutrition may interrelate with the aging process in 3 ways. First of all, most functions of the tissues decrease during the stage of adult life. Secondly, the incidence of the many chronic diseases such as diabetes, cardiovascular disease, cancer, etc. rises with the increasing age, and there is an evidence of relating the etiology of these conditions to the role of nutrition. Thirdly, the recommended dietary allowances of the elderly person could not be met due to the less consumption of the diet as they grow old, which results in the low nutrient intake to meet the requirement. There are many age-related body changes along with the nutrition. Many changes occur in the body of an aged person and certain diseases are unavoidable. The rate of the changes are modulated by the progressive changes taking place in body composition, metabolic rate, tissue functions and the nutrition. The olfactory and the gustatory perceptions diminishes with the advancing age. The decline of these 2 senses results in the dwindling of the appetite and also lessens the amount of food consumption. Loss of teeth owing to the caries of the teeth and periodontal diseases affects in the intake of the nutrients. Moreover, decreasing in the secretion of saliva results to dryness of the mouth, as well as there is increase in the non-propulsive contraction in the esophagus, which leads to dysphagia. The reduction in the secretion of the gastric acid leads to diminished digestion and absorption of the iron. Pancreatic enzyme secretions are not very much changed, so fat digestion absorption is not reduced. There are changes in the body size and the composition. Body height and body weight tend to decrease with the increasing age. Loss of the muscle mass, bone tissues and reduction in the organ weights accordingly changes the body composition among the elderly. About 1 to 2% of the lean body mass declines and fat increases by 0.5 to 1.5% annually around the age of 30 years. Decrease in the extracellular water also occurs with aging. The rate of the loss of body cell mass is higher in male as compared to female. Protein requirement is positively related with the body composition and outcome is partially compensated by the simultaneous loss of the extracellular fluid, thereby reducing the change in the quotient BCM divided by body weight. Let's have a look at the energy expenditure. The energy requirement in the content of the diet depends upon the energy expenditure of the body and also usually influenced by the body size, body composition and sex. It varies to the maximum extent according to the amount of physical activity. The expenditure of the energy among the elderly may be affected by the several factors in different ways. Some of the important factors are: number 1, the basal metabolic rate; Number 2, the change in the amount of physical activity. Number 3 is the alteration in the efficiency of muscular activity and of the movement. It is generally considered that 10% of the reduction in the basal metabolic rate possibly occurs between the age of early adulthood stage and about 60 years of age, and another 10% of the decline by 75 years of age. Variation in the physical activity in the elderly and in the younger group of moderately active people is found, but this variation may be skewed to the lower end of the range because of those elderly who suffer from increasing fatness, disability and loss of muscle tone. Hence, the calorie prerequisite reduce with the advancement in age, which is about 25% less than those of the normal adult engaged in sedentary work. As per ICMR, recommended calorie requirement for the elderly male and elderly female are 1800 kilocalories and 1400 kilocalories respectively. Now let's see the nutrition requirement of the elderly people in terms of different nutrients. The recommended allowance of the proteins for females and males elders per day are 50 grams and 60 grams respectively as per the ICMR recommendations. The average daily diet of 12 to 14% of the calories should be derived from the proteins. Food which provide high quality of proteins are meat, fish, egg, chicken, organ meat, pulses, mushrooms, milk, cheese, oil, seeds, nuts, etc. There is no difference in the desirable fat intake for the older adults from those of the younger adults. 10 to 20 grams of the fat should be contained in the daily diet, but only half of the quantity should be in the form of vegetable oil, which is rich in the essential fatty acids. High content of the saturated fatty acid diet such as ghee, butter, coconut oil, hydrogenated fat may raise the blood cholesterol level. Ginger oil, sunflower oil, refined oil, groundnut oil, rich brand oil, which are relatively rich in the polyunsaturated fatty acids, tend to decrease the blood cholesterol level. The maximum amount of carbohydrate requirement in the body is placed between 50 to 70% of the total energy. Food items such as rice, wheat, tubers, etc. are the rich source of carbohydrates. The function of the vitamin is not to yield energy but act as catalyst in various body processes. They should be supplied from outside the body through diet because vitamins cannot be manufactured in the body itself. But it is very important nutrient required in the body because its deficiencies can cause serious nutritional problems affecting the elderly people. Elderly should probably take vitamins and mineral supplement with a food energy intake of approximately 1500 kilocalories. To maintain the glucose tolerance and normal cognitive function, the metabolic demand for vitamin B6 is higher in the elderly. Vitamin E and vitamin B6 supplement has been shown to increase the dynamism of the immune reaction, which slows down with the age. Elevations in the homocysteine, which is an independent risk factor for the cardiovascular disease, depression and certain deficit of the cognitive function, can be controlled with the increase in the status of vitamin B6, B12 and folate. Consumption of the antioxidants such as the vitamin C, E and beta carotene regularly have shown a reduced risk of cancer, cataract and heart diseases among the healthy elderly. About 24 minerals are contained in the body which are needed for various functions such as formation of the bone and teeth, maintenance of osmotic pressure of the body fluids for serving specific functions such as blood formation by iron and normal and functioning of the thyroid by iodine. Those minerals include calcium, phosphorus, iron, sodium, potassium, chlorine, sulfur, magnesium, iodine, zinc, manganese, molybdenum, cobalt, selenium, chromium, bromine, fluorine, aluminium, arsenic and few others. Some of the minerals are required in micro quantities for the body and hence they are known as the trace element. A well-balanced diet contains all these minerals in sufficient quantity. The daily diet has a bulk of dietary fiber. It upholds the good intestinal motility, creates regular bowel movements, and prevents from constipation. The daily requirement of the dietary fiber in the diet of elderly should be 40 grams. Along with this food, high fluid intake is also necessary. Food products which contain the rich amount of fibrous matter or roughage are millet, wheat, ragi, horse gram, rice bran, plantain stem, cabbage, cauliflower, drumstick, guava, wood apple, etc. All these nutrients have been shown in this figure. Now let's have a look at the guide to healthy eating in old age. Studies on dietary intake conducted among elderly population around the world provide general knowledge on the eating habits of the older adults. Energy intake declines with increasing age, while the average protein intake still commonly remain well above the recommended levels. Older adults generally take fat, saturated fat and refined carbohydrate above recommended level, which is almost similar to those of the younger adults. The intake of the complex carbohydrate and fiber is below the recommended level. Some subgroups within the older population are at a greater risk of malnutrition because they are likely to consume the poor diets. Those nutrients include calcium, zinc, magnesium, vitamin B6 and folate. Issues on the bone health among many older people, especially women, are due to low calcium intakes. Misleading impact of the zinc or poor zinc status may delay in the healing wound and also deteriorate the immune response in older adults. National Institute of Nutrition, that is NIN, in 2011 has recommended the dietary guidelines of the elderly. They needed very fewer amounts of the calories to maintain their weight as they are physiologically less active. Avoidance of the use of the saturated fat like the ghee, butter and vanaspati and the restriction of the daily intake of the oil to 20 gram is important. Vegetable and fruits are also very important in the daily diet. A minimum quantity of at least 200 to 300 ml of low-fat milk and milk products and 400 gram of vegetable and fruits which are rich in fiber, micronutrients and antioxidants are also recommended. An elderly diet also needs egg and pulses. Frequent and small meals with adequate amount of water should be consumed to avoid from the complication of dehydration, hyponatremia, decreased level of sodium in the blood and constipation. In order to remain healthy and active, the elderly require more of vitamin and minerals as well as micronutrients rich food. Further, to maintain body weight and to decrease the risk of degenerative diseases, exercise has also been recommended. However, the schedule of the exercise should be decided under the consultation of a physician. Hence, judicious food choices can delay the process of physiological aging, which in turn will ultimately attain good nutritional status, good health and good quality of life among the elderly. The elderly nutritional health complications and their management need to be understood in more details. The health of the elderly needs special attention because they are seriously threatened by both states of nutrition, that is under and overnutrition. Those who are undernourished may manifest by the chronic energy deficiency, anemia and other micronutrient deficiencies like that of vitamin A, C and zinc. It is considered that changes in the lifestyle to improve the future health are no longer advantageous in old age. That the benefit of the modification in the remaining years are not enough, which are often perceived that it will reduce the enjoyment of the food. Some of the complications which are generally faced by people in old age are discussed. Chronic undernutrition can lead to serious health consequences such as increased risk of fall, fatigue, breathlessness, depressed immune functions, memory loss and depression. It also increases the risk of morbidity. The root causes of the undernutrition among the elderly are abnormal absorption and poor utilization of the nutrients and low food intake. Not only these, the side effects of the drug result in less appetite, increased urination and drug-nutrient interactions. There are numerous means by which nutrition can be affected by the drugs. Many of the older adults complain that drugs change their sense of taste and smell. Dysphagia, that is discomfort or difficulty in swallowing the food, and other problems may sometimes make difficult to eat. In addition to all these biological factors, social factor may also cause problems, which may include living alone, inadequate income, and restriction in procuring and preparing the food. The next could be the overnutrition or obesity, which is also one of the chronic health problem and an emerging cause of concern among elderly women. This predisposes them to decreased body functional ability, cardiovascular disease, arthritis, gout, and increased mortality. Osteoporosis is very common in the postmenopausal stage of the life among women. At this phase, the bone mass usually decreases due to hormonal change such as estrogen deficiency. The consequences of this is the weakness of the bones due to fragility, porous, lighter in weight, leading to recurrent and spontaneous fractures and delayed healing. Deficiency of calcium because of low calcium intake, reduced intestinal absorption, impaired renal reabsorption, and reduced production of the active form of vitamin D can worsen the bone demineralization. The condition of the osteoporosis is a metabolic supplement of advancing age, which may cause thinning of the bones. Locomotor disabilities increase the risk of spinal compression and hip and wrist fractures. Deficiency of calcium and vitamin D deficiency can have the risk of osteoporosis, especially among elderly women. Supplementation of the calcium and vitamin D can help the postmenopausal women in reducing the markers of the bone turnover and slows the rate of bone loss, therefore benefiting women with low dietary calcium. Nutritional anemia is commonly observed in elderly due to iron deficiency, folate deficiency, and vitamin B12 deficiency, and also the causes can be nutritional, pathological, or physiological. Iron status is usually affected by the physiological constraint of poor absorption and utilization, along with consumption of heme sources, green leafy vegetables, and fruits. The absorption is also inhibited by consumption of the beverages such as tea, which contains tannin and phthalates in cereal-based diets. Among diabetes with advancing age, there is a progressive deterioration of the glucose tolerance. Older adults are generally prone to non-insulin dependent diabetes mellitus and have the highest mortality from atherosclerotic complication related with the diabetes. One of the important risk factor of cerebrovascular diseases among elderly people is high blood sugar. The complications related to the diabetes can be helped by management of the weight, dietary modifications, and moderate exercises. Now let's see the nutritional requirement in cardiovascular diseases. The prevalence of the cardiovascular diseases like angina pectoris, congestive cardiac failure, hypertension, acute myocardial infarction, and hypertension are very common among aged. This can be managed by modification of lifestyle, reducing salt intake, self-restraint from alcohol, smoking and tobacco use, maintenance of ideal body weight, and moderate physical activity, which would help in increasing the HDL cholesterol and reduce the tendency of the blood to form the clots. Arthritis is a disease which causes deterioration and crumbling of the once smooth cartilage covering the bone joints through formation of calcium deposits. It causes inflammation and pain in the joints. Disability among the elderly is mainly caused by osteoarthritis, which becomes very common. Maintaining ideal body weight is the only diet-related treatment which may give some relief because weight gain adds extra stress to the painful arthritis joints. Now let's have a look at the dietary recommendation during constipation. Low intake of the dietary fiber, lack of physical activity, and insufficient fluid intake can lead to have problems of constipation among elderly. Moreover, it may also be caused by the effect of the medications and delayed transit time in the gut. All these complications can be prevented by consuming the fiber-rich diet, drinking plenty of fluids, and exercising regularly. Alzheimer's disease is a disease which causes the patients to lose their memory, ability to reason and comprehend. It is an irreversible and progressive deterioration of the brain. It is harmful to the mental and the physical health of the older adults. The main causes of this disease could be modifications in the protein production in the brain, obesity, stroke, diabetes, hypertension, altered blood lipoprotein composition, and high free radical levels. Sufficient intake of antioxidants, nutrients such as vitamin C and vitamin E could defend the body from the damaging effect of free radicals. The risk of Alzheimer's disease can be reduced by adequate consumption of folate, vitamin B6 and B12, diet rich in omega-3 and omega-6 food, and low in saturated and trans fatty acids. For improvement of the mental status in people suffering with this disease, regular physical activity is recommended. Now let's summarize this module. We have understood that energy requirement of the elderly is different from that of the young adults as the nutritional requirement because the metabolism slows down and physical activity also decreases. The efficiency and function of the various organs and systems of the body show decline with advancing age. In order to promote the healthy lifestyle, the interrelationship between nutritional status, health, disease and morbidity among the elderly need to be understood. Considering the age-related physiological changes, appropriate dietary chart should be planned. Elderly also need special modifications in the texture and consistency of their diet due to dental problems. Both the state of nutrition, that is undernutrition or overnutrition, pose serious threat to their health, and the elderly are a vulnerable group prone to the different disease related to nutritional intake. Thank you.